Hi there, welcome to HLS Webcast Virtual Rounding version 2. I'm your host, Mike Giannotti, and I'm joined today by our moderator, Samantha Sam Brown, and with our presenter, Max Fritz, who's going to be showing you the new solution, the V2 of virtual rounding. And this is a great solution, for those organizations looking to minimize contact with patients where there may be contagions or other issues, or to be able to scale and provide ready access for those clinicians. But before we get started, a couple of things. Number one, I'm not going to be eating lunch today because I am getting, as Sam pointed out, so my social distancing multi-chins. But we're going to go through real quickly. That's right. We're going to go through real quickly a couple of housekeeping items. As always, this event is brought to you by the Microsoft Healthcare and Life Sciences Group. You can always find my colleagues such as Max, Sam, and others at our blog at aka.ms/HLS blog. That's aka.ms/HLS blog. Be sure to check it out and to give us a follow there. Couple of things real quickly. We have a moderated, I think I went no, I guess not. I guess I deleted it. I deleted a slide I should not have. So real quickly, before we go to the Q&A panel, this is your session. We encourage questions from the audience, so please ask. Your questions are moderated. You don't have to worry about them showing up for the whole audience. We'll only publish those if we need to. Typically, Sam will queue those up, and then she'll verbally tee those up for Max in this case. So, go ahead and ask. Also, we love to hear from you. We love to know where you're watching us from. We get folks all over that tune in. We've had folks in St. Petersburg, Russia. We've had in various places in India, Pakistan, Jordan, Brazil, Japan. I've even had Hong Kong. We've had folks from all over the UK, Ireland. We love to hear from you, where you're watching us from. So please, if you have a chance, give us a shout out. You can put your name if you're comfortable, your first name, or just, maybe the city, state, or country where you're joining from, or all the above. But give us a shout out. We love to recognize you. And just, again, it's a lot of fun to see where people are joining from. So real quickly, one last thing. At the end of this session, I know it'll be asked again. Yes, we are recording it. Yes, this is being recorded. So at the end of this session, later on, my colleague Samantha will be taking the recording, putting it up to our blog at, yes, aka.ms/HLS blog. That's aka.ms/HLS blog. And welcome, Chris, from Washington State. Booyah. Washington State, the Huskies. So at any rate, so that's it for our kind of housekeeping. Real quickly, to engage us, I see we're already getting that. We've got Brian from BC and from Vancouver, British Columbia, Canada. And we got a thumbs up already there. That's awesome. But if you don't know where to talk to us, on the right-hand side of your screen should be a QA panel. If you're not seeing that, in the upper right, you will see a dialog box with a question mark. Clicking that will open it. It'll also close your QA panel. So you can open and close at will by selecting that up there. Once you do so, you'll be greeted with this view where you can put your name if you desire. You can ask a question, post as anonymous. It's up to you. And that's where, if you want to give us shout outs, if you want to give us, like we have from Boston, booyah. I love Beantown. Great food, great seafood. So at any rate, that's where you can give the Q&As and ask questions as we go. So, please let us know, if you have questions. Max will be pausing here and there to field those. And I believe with that, we are on to the presentation. So we're going to go full screen with that. And Max, if you want to share your screen, it'll push mine out and you've got the controls.
Absolutely. Just a moment here while we get that out and presented for you guys. All righty. You should all see that appearing on your screen.
Not yet.
Not
We're
yet.
not seeing your screen yet.
Oh, click the wrong button. Happens to everybody. Let me know, folks.
There we go.
All right, I'm going to go ahead from Mike. Thanks for joining me, everybody. This is Max Fritz here, joining my wonderful colleagues, Mike Gennady and Sam Brown. I am also one of our HLS, or Microsoft Health and Life Sciences technical specialists, focusing on teams, collaboration, and all sorts of wonderful stuff. So today we're going to be talking about virtual rounding using Microsoft Teams, which is just the catchy phrase that we have for our solution here. You may have seen this blogged out roughly, oh gosh, it's been almost 4 weeks now, maybe 3 weeks, something like that, on our HLS blog, which I'm sure you all faithfully follow. And we're here today to talk a little bit about updates, things that we've heard from customers, feedback, all sorts of wonderful things. In the past 3 weeks, we've got a wide swath of customers using this. The solution, as many of you figured out and we can now publicly talk about, was started and created for Allina hospital system up in Minnesota. And it has been just wildfire growing throughout customers. And I'm sure a lot of you here are looking at it, are already starting to play with it. We really hope you guys can find some value in this. Again, this is just, we want to help address this crisis, and I sure hope that if I was in a hospital or some sort of clinic with COVID-19, I'd have a nice way to communicate with my doctor. Anyways, let's go through a little bit of what we're going to talk about here today. So our agenda, we're going to go through a quick overview. I'm going to talk to you about our problem statement. We won't go too deep into that because everybody here is involved in healthcare. We all know the problems that we're dealing with today, but just a little bit of what we're trying to address. And then we'll dive into the solution details, what we're doing, how it works, how you could use it in different environments. We're going to talk about V2 or version 2 enhancements, which were released about a week ago now, maybe a little less. We're of course going to spend a ton of time demoing, walking through how you can set this up. We don't have time in this 1 hour webcast to actually set it all up together, but I'll provide you some good resources to get started. And then of course, Q&A at the end. However, as Mike pointed out, this is a live event. You should ask questions as you have them, and we'll address them as we go along. So without further ado, let's get started and talk about what we're trying to address here. So the main problem we're trying to address is that as a provider in a hospital, your employees are, making dozens or hundreds of rounds a day. This obviously doesn't apply to every provider out there, but our floor nurses, our doctors addressing patients in ICU, things like that. We're making rounds, checking in on our patients, having conversations with them, the difficult conversations to the just, how are you doing today? And that works great when we have patients that are maybe sick with something that isn't infectious. In those situations where we have an infection, though, something like COVID-19, or before that, just our standard run-of-the-mill, still terrible infectious diseases, we used PPE, or personal protective equipment. We put on masks and gloves at the least, and probably a little bit more in addition to that. But we got a problem right now. In the US and across the world. This has been going on for longer than I wish, but we're really low on masks, and gloves aren't exactly in high supply either. So what do we have? We have patients, we have providers that are really able to, they're being forced to use these masks for multiple occasions, homemade masks. Even I've heard of some unfortunate scenarios where they just have to cover their mouth with a sleeve or something like that. Hopefully none of you are in that situation, but by using these less than optimal methods, these providers are walking into these patient rooms with less protection than they should be. And we all know what that can potentially mean. It could mean that that provider is at risk, and that provider could then become infected and then be able to serve less and less patients as time goes on. We have less providers. It becomes cyclical. It's we don't want this for sure. So The two problems we're trying to address here first, we have a shortage of PPE, and even if we didn't have a shortage of PPE, we have increased direct patient contact that's happening with these at-risk patients. We have more infected patients than we've dealt with in a long, long time. And in terms of that, we have more patients than we're dealing with in a long, long time. Everybody's talking about when is my state going to get the peak? When is Minnesota's peak? When is Iowa's peak? When is New York's peak? When is California's peak? And regardless of peak, we're just seeing an influx of patients who are infected or potentially infected with COVID-19. And that means that we actually are using more and more and more personal protective equipment beyond what we're normally used to, which of course I don't have to tell any of you, but this is why we're running out. So how do we solve these three things? A shortage of PPE, a increased risk to healthcare providers, and a higher load of patients altogether. So this is what we're working with here. And the solution that we've come up with is putting Microsoft Teams in between the providers and the patients where possible. We, of course, want you to be able to deliver the best level of care you can to your patients. However, given the current situation we're in, we want to help provide creative methods where you can deliver that care. Maybe in person just doesn't make sense all the time. Now, I'm not suggesting we put a robot doctor in the patient's room and say, okay, this is who you interact with now, John. Instead, it's a situation of where could we minimize or reduce the amount of provider risk there? When is it maybe not necessary for the provider to walk in? Of course, somebody's going to walk in that room once a day. At least there are basic patient needs, basic human needs that need to be taken care of. But where can we leverage a technology like Teams for that one-to-one interaction using technology? And so this is the solution we've come up with using Microsoft Teams here. Now, I just want to put out there that this can be used in so many different ways. Huge credit to my colleagues who put together all of these use cases here. But this doesn't just have to be used for our one-on-one patient communication to provider communication. These kind of technologies, Microsoft Teams, could be used for way more than that. Family inclusion, a secure messaging solution, even interop with things like the FHIR protocol to integrate with your EMR. If you are looking for a solution that can help deliver that better patient care virtually, but still give us everything we need, there are tons of possibilities, and this is an open door. I know that we had Jim on a couple weeks ago talking about a solution for reaching out to family members using Teams and using Skype on the family side. There are so many different ways that we can do this, and we want to let you know that we're here to help with those different things. But today we're just going to focus on virtual rounding, specifically the doctor-to-patient communication and a little bit of the family and external contact as well. That's the immediate need we see needing to be addressed, and that's what we want to hit first out of the gate. However, everybody's priorities are different. We also want to make sure that you remember that this solution doesn't have to be something that is just coronavirus related, that as you're deploying new things within your organizations, all of these different things that we're putting in front of our healthcare workers to help address COVID could potentially change how we do healthcare in the long term. And looking at devices and things like that that are going to help make this a long-term solution is sometimes a prudent conversation as well. Okay, so let's talk about how this works. So our virtual rounding with Microsoft Teams. Here are the basics that you need to know. Each room or patient bedside is set up with a device that's locked down to Microsoft Teams. And when I say locked down, for those technical folks in the room, I'm talking about we use mobile device management such as Intune to force the device into kiosk mode or assisted access mode on iOS, whatever that might be, to make sure that this is really dedicated to the patient. And even within the Teams client, we're going to disable all the things that we don't want the patient having access to. Meeting chat, recording, browsing the gallery, things like that. Now, this is not something that the Microsoft engineering team developed and where it's all custom built necessarily, but we're leveraging existing things like Teams policies as we're going to go into to make all of this work. Now on our provider side, at least in one way we can do this is our providers are going to be members of teams for maybe a building or a location or a clinic that they work at, and then they can access the meeting links to join ongoing meetings that are constantly running in the patient rooms. So each one of these devices in the patient rooms is constantly sitting in a Teams meeting, waiting for providers to come in and out, as in virtually around. It's like walking in the door to the room to the patient. Now, as Mike talked about at the beginning here, we're here to talk a little bit about version 2. Version 2 is a complete rewrite, similar to version 1, but we've added a ton of enhancements and made this a little bit easier for you to work with. Some of those things are the ability to invite external participants. This could be a family member, a friend, a religious figure, maybe even a lawyer for a will. It can be any sort of external participant that we want to. We have then created a couple Power Apps, which is Microsoft's low-code app development platform. And we provided these templates out for you. One of them is for the patient join experience. This makes it a little bit easier for the patients to join into the device, or if the nurse is controlling the device, the nurse to do it as well. Ideally, most of my hospital systems that are using this do not have the device within patient reach. However, some customers have chosen to do that. And in that case, we still want that lockdown experience, but an app to join with. And then we have a new app. This is the big one that's for your providers for join and configuration. We got 4 basic functionalities there. You can join the meetings through the app now. You don't have to browse through your Teams client. You can invite an external participant, those family and friends and those people we talked about before. If you'd like, we can have it so you can set a patient name or MRN to make sure that you know what patient this is before you jump into the meeting. And then a reset meeting button, which makes it so that we invalidate all those external links we sent out, and that the patient name or MRN or whatever attribute you want to use is also reset so that we're ready for the next patient to walk into the room. And then last but not least, we've created some simplified scripts for configuring all of this. So with all that being said, let's start looking at a demo and see what this looks like here. So I'm going to pop open my environment here, and lo and behold, right in front of us, here is our virtual rounding Power App. Now, the way we recommend you deploy it is within Teams, because it's going to launch Teams meetings for you. That's the whole purpose of it. That's what it's built to do. If you have this deployed somewhere else, or you get people linked to the Power App, it's going to launch different windows and stuff like that. And that's not ideal. Ideally, your providers are using the Teams desktop client on Windows, Mac, or Linux, or they're using the Teams mobile client on Android or iOS. And this is how this is going to appear here. So in our demo environment, we've got just a couple buildings and a few different floors. If I choose building 2, you're going to see that it changes our sublocations. Building 1 has a floor 1, building 2 has an emergency department, and then we can go deeper into floor 1 and see our rooms in there. Now here we can see room 101 and room 102. I can immediately see that room 101 is already set up, and we have John Doe sitting in that room waiting for us. So let's see what that looks like. Now I'm going to click the join button here, and you're going to see it's going to give us a confirmation page. Hey, Max, provider, whoever I am, click this button to join the room, but make sure, is this the right room that you're entering? Know that it's already been shared with an external participant, so there is the possibility that the patient is already chatting with a family member or something like that. And if I want to make sure that doesn't happen, I can go back and I can reset the meeting on the configuration page, which we'll come back to. And a polite reminder to our providers to not use the chat feature in the meeting unless we want PHI in there. Now, that's really crucial. When we go into our policies a little bit later in this webcast, we're going to notice that we only disable the chat feature for the patient devices, not for the providers, because by disabling it for the providers, we'd be disabling it for all of their Teams meetings, which wouldn't be ideal. So once I'm ready, I click Join Room 1. Now I'm in a web browser here, which I told you not to do. So it's going to open a new tab for me, but that's okay. We'll just hit continue in the browser, and the full Teams desktop, it will bring us straight to this page we're about to see, where I'm able to join. Now we're going to do audio off so we don't get an echo, because I do have a device in my room that is set up and joined. Now you can see here I am as the patient talking to my doctor. The doctor can then have a conversation with the patient. The doctor could even present out materials if we choose to let them, all sorts of things like that. Now, as a doctor, I'm going to hang up this meeting as much as we love seeing my face. And again, using the full application, we'll be back to our Power app or our meeting screen where we can then go into a new room. So it's that simple for our providers to simply pop in and visit the patients. Now we have a configuration screen. Let's click on Configure Room instead. In here, we can see all of the patient details. I can see that it's been shared to 4 different participants so far, external that is. I can see the last time it was shared out, and I can see the last time we actually reset this room. Now let's look at these different functions here. Let's start out with setting the name. Let's say I noticed a typo in the name. This isn't John Doe, this is John Brown. Let's click Set Name. It'll let us know if it succeeded or not, and bring us back to our home screen. And there's John Brown now listed as the patient name. Oops, let's go back to our configuration page. I can also clear the name, which now clears out that patient name for us. Here, I can invite an external participant. Let's go ahead and share this out. We'll hit invite there. Now we'll come back to that external share in just a moment while we wait for the email gods to let the email through. But if we go back to configure, we can now see it's been shared to 5 external participants. The last button that we have is reset meeting. Now I'm not going to click this in our demo today because we've got a lot of things set up residing on this meeting working, including my patient device being joined. But what will happen is we'll set a last reset date. This will be zeroed out, and the patient name will be set to blank if it's already been set to something. A few things to understand about reset meeting. If we reset the meeting, that does not cause our patient device to leave the meeting that they're in. It doesn't end that existing meeting. So it will require somebody on the floor to go up to the patient device, end their existing meeting, and join the new one. Now, let's see if the email gods have behaved with me so far today. Fantastic. I've got a new email here that I've been virtually invited to visit a patient. Now this email we put together real quickly and put it simply so that you can customize this, and we'll show you where you can customize this in a few moments. But if I click this link, and I'm going to open it in an incognito browser to make life a little easy for myself, or in private. It will quickly bring us to a page where we're able to allow the webcam or microphone. I'm going to say this is Max's mom, and we'll do audio off again so we don't get an echo. And then crucial to this that I actually don't have properly set up in my demo environment is you can't have the lobby on for these meetings. Otherwise, the patient's stuck seeing that there's somebody in the lobby and they can't touch the device. But here, I let in the guest, and once I'm done here as that guest user, I hit hang up. And again, I'm done. And I can refer back to that email whenever I want to pop back in or out of the meeting until somebody hits the reset button. That reset button could be hit on purpose to make sure I can't join that meeting anymore, or it could be done later on when a new patient enters the room. We can put any detail we want in here, formatting logos, the patient's name, anything that you want. I even customize the from email address to make sure that this is custom to what you want to be doing. The last thing I want to look at from the user interface perspective is the mobile device. And for that, we're going to open up a little application here. Actually, let's look at it from the web browser perspective. This could be on a mobile device, but we're just going to look at it as a web browser here. Based on the policy that we configured, we have only one application that shows up here. And this is our patient join application. It's a Power App again, published to Teams. And this is the one button that is clicked by the nurse ahead of time to join the meeting. If you have it set up where the patient can actually interact with this device, you can put something at the bottom here as well, a note to the patient, and even the ability for them to invite an external participant if you want it. But we have the big join button. You click that and you get the gist here. If we're on a full Teams client, it brings us straight into the Teams meeting. Now let's look at what we can do as the patient though, if we're able to browse other areas. The calendar app is still available because that's required for meetings. The activity app is still available, but that's only going to show us our recent activity. The help app is part of Teams. Stream actually won't function for us because we don't have a stream license. Teams will show us any teams that we can publicly join. So public teams are not recommended during this period. And then we have the wiki, which we can clear out on a programmatic basis. The Files app is also there, but we're not going to see anything because OneDrive has been disabled for this user. All right, so let's go back. App Store, really nothing we can do here. Can add to a team, but we're not a member of a team. We can add to a chat, but there is no chat. Excuse me. There's no chat tab. There's no calling tab. It's really about the patient join experience. Again, we recommend that this not be a device that the patients play around with or touch when possible. If you're looking for something that is more hands-on, that the patient is going to interact with it, the solution that Jim showed a couple weeks ago, which you can refer back to our HLS blog to see the recording of that, may be a better fit. All right, so let's take a peek under the hood at how this is all working. The first thing let's look at is how does this application work? This application is built on one big SharePoint list that we're using as a mini database. As long as you're under a few thousand rooms or devices on this, SharePoint should work just fine for you. If you're going to go over 5,000, we have other database solutions in Azure and in Power Platform that might work better, but we've built this as quick and easy to deploy for you. So in this list, we have a few different columns. We have the title, which is the name of the room, the meeting link, an event ID, which is used on the back end for some calendaring purposes, and then all of those things that we saw in our details pane in the Power App. All of this is kept on a back end list, which your users will have read access to and potentially write access to, depending on the needs that they have within the Power App. All of this is on a site that we don't recommend you publish to anybody, that we kind of just keep there in the back end, and we don't push it out very, very much. And then there's just one list to make it nice and easy for you. Now, the fun part is how do we provision that? And for that, I'm going to open what's called Visual Studio's code here, which shows us how this all works. So we have a PowerShell script up there. And if you're not a script person, I know there's a lot of scary colored text, and it is for me too, don't worry. The basic gist of this script is it's going to create for us that SharePoint site, that list, and all of those columns in the list that we just saw. And it's going to set that up for us programmatically and make it very simple and easy for us so that we're ready to populate in that information. The next thing we need to do is we need to have accounts for each of those patient rooms. So each of those patient room or patient device accounts is going to need an Office 365 license. That could be an F1 license, F3, E1, E3, E5. I know everybody loves the Microsoft license acronyms, but basically if it's got the words Office 365 in it, it's going to work. And the core things that we need out of that, which is in our documentation, is we need the Exchange license, the SharePoint license, and the Teams license. With those things working, we're set to go. But we understand that you're probably going to be doing a lot of rooms, or hopefully going to be serving this to a lot of those devices. And so going and creating account by account by account through the admin center may not be the desired method. And so we do have a create room script that does a very similar thing to set up SPO. It just basically creates all those accounts for us and gives you a list of all the passwords so that you're ready to sign in on those devices. With those two scripts, we're ready to go. But the next thing is, how do we get the meetings set up? How do we get those configured ahead of time? And for that, we're going to use Power Automate, or you might know it as Microsoft Flow. I'm going to go into my flows here, and you'll notice I probably have a lot of different flows. Oops, got to switch to the right area. And this is using my admin account. This is the same account that I used to set up everything that I did so far, to create the SharePoint site, to create the room accounts, all the things like that. And we have a setup room meetings flow. This is out published for you to consume. But if I go in to edit this flow, we can see what's going on here. Lots of different variables that you need to set. We can skim by those. I'll show you the basics of it though. What we're doing is we're getting the group that has all of the room accounts in it. That was part of our setup room script. We then get some basics of the user profile for the room account. We create a Teams meeting link. We create a calendar event to put that on the user's calendar. And then we create that SharePoint list item with all of the details that we talked about before, all the things that we need, the room location, sublocation, meeting link, all of that. This needs to be only run once, or anytime you add more rooms to your setup. It's a one-time deal. It does require what we call a Flow premium license. You might know that as Flow per app or per user license, but only one of them. And that just needs to be assigned to my admin account for running this PowerShell, or excuse me, running this flow. And free trials are available of that. I want to be clear about all of this, that we have free trials and some extended free trials for COVID-19 of all of the licensing you will need to get this accomplished, including the room accounts that you will need for the various different patient-facing devices. So the next thing we want to look into is the other backend here, and that is going to be in our Power Apps. This is how those apps work, like this one here that we load in. And I'm going to show you how simple it is to really start customizing some of this. So I'm going to go to my apps here, and let's open up our most basic of apps here. Let's look at the Patient Join app. We're going to go into edit mode. And we're going to look at the things you might want to customize. Now you can customize anything you want about these apps. They are yours to play with. But let's say you said, you know what, Max, this isn't going to be something I want my patients touching. Therefore, I don't need patient instructions, and I don't want that invite somebody link there either. It's as simple as just deleting those. Once I'm done, I publish that out. Now I'm going to undo that because I need them in mine. But if you want to do that, you can simply do that. Let's say you want to put in a different image. You can go ahead and delete this image. And you can insert your own image. Very simply. And lastly, if you want to change the color or font, you can go to Theme and change from one of our built-in themes. Or you can create your own theme and customize the colors specifically with RGB codes if you'd like to. Now let's exit this one, and let's not save any changes. And let's open up our virtual rounding application, which is a little bit more advanced. Now, here's our virtual rounding application. On this one, we've got 4 different pages. The first one is really selecting our room. We don't recommend that you customize anything besides colors, texts, and images, which I know is a lot. You can, if you're doing this by building or by clinic, you can say select a building or clinic instead. And if this is always going to be floor, you don't have to say sublocation. That's not very end user friendly. And then if you want to customize anything else, well, you know how to do it. We can change our theme here. Well, that didn't show up too well, but by changing the different color schemes, we can get this to be a little bit more customized to our organization pretty simply for us. Note that there are a bunch of different pages though. where we can customize things. Now, let's say that setting the patient name isn't something you want to be doing, that you don't want that information in the system at all. It's just not something you're comfortable with. Well, as you can imagine, it's as simple as finding all of that, deleting it. And now I'm going to select on this big box here and click Edit Fields. At this point, I can remove our patient name from there, and we're set to go. I can, move these around and make them a little bit easier, but if you've used something as basic as PowerPoint, it's not too hard to drag and drop these fields and these things around. The last thing we can customize is what's on our joining room screen. We could delete this message if we want to. We could customize the colors, put in some more provider instructions. Really, we built these to be sample for you, but you can start customizing as much as you want. Now we have a question. I'm going to publish this out that is around what is the in-room device. The question was, is it an iPad or something like that? That's a great question, Brian. Thank you for bringing that up. The patient device can be any device you want. Now we recommend something with a slightly large form factor, not a phone basically, but it can be an iPad, an Android, a Surface tablet, even a laptop. We understand that this is a crisis time and you may be stuck with what you've got around right now. And pretty much if it can run the Teams application, which means iOS, Mac, Windows, Android, or Linux, it's going to be able to handle virtual rounding. Feel free to reach out to us if you want some device suggestions or things like that. We have some great Surface Go's and all sorts of things that can be really suited for this sort of situation and sanitized properly once you're done.
Thanks, Max. We actually have a lot more questions piling in. If we want to pause for a second and go through these.
Yes.
Awesome. So thanks for all of your engagement, everyone. Feel free to keep the questions coming. We have about 20 minutes left. So Chris is asking, and you mentioned this at first, Max, when you talked about the different use cases, but he's saying, how would a customer go about customizing the solution for telehealth for primary care instead of just for hospitalization, maybe when the patient's home and the provider is somewhere else?
Great question. Now, we'll get into pretty shortly here a few of the gotchas or known things that or items that we know about the solution that need a little bit extra care from our nurses to keep them up and running. I wouldn't recommend this solution for your patients while at home. Microsoft Teams has a virtual visits capability built on top of bookings that might be better if your patient's not in the hospital. It's built to be a lot more intuitive and easy to use for the patient to just click a single button to join a meeting.
Awesome, thanks. And so we have a couple of questions around controlling the device remotely. Can you have an option to turn the mic or the camera on or off for privacy? I know you went into a little bit around device management, but maybe we can hit that a little deeper.
Yeah, that's a great question. There is no remote control capability today to turn off the mic or cam on demand for a device, at least that I have found. There may be some ways to do it for Windows, but at least not from the Macs or from the iOS or Android side. It's something that we're looking at pretty heavily to try to make this solution even better. We are working closely with the Teams engineering team to make it so that Teams can handle this sort of thing from a little bit better perspective for a privacy side.
Great, and different type of controls. So with the lobby experience, can we implement controls so that a clinician can't join without being admitted by a nurse, perhaps? Asking in particular about the lobby model. So just to clarify on this question, and feel free to write us back, Max was showing the lobby experience when you join as a patient and they're waiting in the lobby until the provider actually comes in. But I believe this person is asking about a lobby experience for a provider.
It's an interesting question. It's one I haven't gotten before.
Yeah.
just because that would necessitate somebody walk into the room, which was one of the things we were trying to avoid with this solution. However, if you've got a use case for it, I'm sure we can come up with something. Be sure to get in touch with us with one of the links here afterwards, and we can work with you to find a good solution for your use case.
Great. So we have a question coming in about patient privacy. We mentioned about the webcam and that there's no way currently to remotely control this, but there's another question around allowing for a moderator of the meetings to control access to the patient. That's
a great question, and I'm going to hit that here in a few minutes.
Awesome.
It's something that we are we're looking at next. And let me go back to my PowerPoint deck here just to talk through a little bit about the technical details of all of this. Great. All right. And we'll continue to answer questions, everybody. Don't worry. So some requirements that you need to be aware of. I mentioned earlier that all of these devices need an F1 or higher Office 365 license. We have 6-month trials of Office 365 E1 available to all Microsoft managed organizations, which is likely all of you in the chat here and watching this. Those are things that you can get by contacting your Microsoft account representative. The providers that need to access this also need a Teams license. So any sort of Office 365 license will include that as well, anything from small business and up. For setting everything up, we need one global administrator account with a per user flow license. We mentioned that earlier, and there's a trial available for that. And then the big one for this V2, to use the V2 Power App that we showed before, any of the providers that need to access that configuration and join app, you do need a Power App per user or per app license for all those providers. Not the device accounts, but the providers who are accessing them. And we do have trials available for those. If you have questions about the licensing requirements, feel free to ask them in the Q&A. We'll try to address all of them when we can here, but do reach out to your Microsoft account team if you've got more. Now, that's some things that are going to be coming soon. We're consistently working on this, trying to improve it and get it so that it is something that you can use even better. Right now, a known gotcha is that we have a 30-minute timeout happening on all meetings. And obviously that would invalidate the solution. In the meantime, we have a meeting bot that will join the meetings to make sure that timeouts don't happen. It's a little complex in the technical side, but it's easy to deploy. We've got basic instructions for you out there. We expect that to not be necessary within a week or two here, based on some work that our engineering team is doing to remove that for us. The next is we're going to publish a sign-up page for you to watch out for updates. So all of the updates that we're making, these things, if you're looking for any of these, we're going to put a sign-up page out there on our HLS blog for you. Number 3 is provider permissioning. And that was the one I kind of mentioned that I would come back to. That is so that in our Power App, let me switch back to that screen for you. It will be limited who can even see the different rooms, who can join them and who can configure them based on custom permissions that you can put together. We can put it together so that somebody's in charge of the room and configure who can see them. We're still exploring exactly how it will work, but likely the configuration page will also include the ability to give permissions to join this room to certain people and give permissions to configure it. And last but not least, policy templates. We haven't even shown you guys the policies that are required to make this all work for a patient room perspective, but the policy templates are going to help us so that we can skip a major annoying step in setting all of this up. So let me switch over to, we'll take the next 6 minutes to just finish up here, and then we will do some Q&A, dive deeper into any other questions that are in the list. So in this window here, I have an additional page up, and this is Microsoft GitHub here, or not Microsoft GitHub, just GitHub. And this is where a lot of technical people store code and things like that. It's a little overwhelming at first, but understand this is where we keep all of our technical documentation for how to get this set up. First of all, there's a form that you can choose to contact us to get deployment assistance, but always feel free to reach out directly to your account teams. You'll notice that there's a V2 folder here that'll be publicly a larger link here very shortly. But if I click V2, we have all sorts of details and screenshots and things about what this looks like. And then a long list of overview of how this works, the designs, and known limitations, the prereqs that I mentioned before. And then here's our team's policies I mentioned that we have before. So we do have you go through the setup steps to create all of these policies to ensure that this is going to function the way that we've demonstrated it for you. But what our team is working on is actually making it so that you can just click a button and all of these policies will be ready there for you. Now, there's a lot more steps in here that are very technically complex. We're going to set up an app in Azure AD. We talked about the different scripts here. And then there's a little bit about our meeting creation, meeting bots, how do the Power Apps work. If you are considering the solution and you're from the IT side or the technical side, what I'd strongly recommend is thoroughly read through this document. If you identify that there's anything that you're uncomfortable with, reach out to your Microsoft team. Now, this isn't something that we can deploy for you, but we do have some fantastic Microsoft partners that are actually literally offering free deployment assistance with a few conditions, of course, to help you get started with this. They understand the urgent need to get all of this going, and our Microsoft team can help you get in touch with one of those partners to move forward. If you do feel comfortable with all of this, which includes Flow, Power Apps, Graph, PowerShell, SharePoint, and Teams all together, which I know some people are, feel free to go ahead and deploy this, and we'd love to see you make it your own. We're also accepting contributions. I don't mean that in the financial sense, but in the examples or code sense. GitHub is meant to be a community tool. So if you would like to upload your own version after you've deployed it and customized it and maybe found a way to make it better, we'd love for you to share that with us, either by emailing us or contacting through the official GitHub methodology. To round things out, I'm going to share one last screen with you guys of what you can do to really get started with this. And right here, we've got our solution details, which shows a little bit about V1, and our technical documentation where you can get to V1 and V2. We still have V1 out there. It's still something that you can utilize without all of that Power App licensing. It's just you don't get the family join experience or anything like that. Please reach out to us if you have questions. We want you guys to succeed on this. We'd love for the hard work on this to be used by as many customers as possible. With that being said, I'm going to leave the screen up and we can start doing a little bit more Q&A.
Great, thanks, Max. And we have been able to respond to a lot of people privately if you have a one-off question that was specific to your organization. But feel free to follow up with us if you do have others. We have about 10, 12 minutes or so left. So one of the questions that was asked consistently is this going to be recorded, and where are the resources, and where can I get the information that Max is referring to? So today I am taking this recording and it will be on aka.ms/HLS blog. I also published that to someone's particular question about the resources. So make sure to check that out. It'll be there by the end of the day. And one of the questions for you, Max, is that we got more clarification on the gatekeeper role. So in terms of the moderator role within Teams, do you think that that is a permission set that might be available? Obviously not within the default template that you've created in GitHub, but something that they could play with for moderating the meeting.
Certainly could.
Okay.
The answer is always yes to if you could play with it. What I plan to do to make a moderator of sorts work is put together a separate SharePoint list, which would house, again, all of the patient accounts or these device accounts, and then have a list of all of the users that can moderate that device and the users that can join that device.
Awesome.
And then
Okay.
configure the Power App to respect that. That I do expect to take at least a week for us to be there from our Microsoft perspective to have anything around that. And it's still something we're working through from a development perspective, so it's not a promise yet, but we're going to try it, and we'd love for you to try on your own and share results with us.
Awesome. And so someone's asking about the prerequisites for getting help from Microsoft on deployment. So just to reiterate here, we do have all of these resources that Max and team have done a wonderful job of creating for you. So all of the technical documentation is in GitHub. We also have this webcast, as well as Max did one a couple of weeks ago on virtual rounding. And so we'll definitely link those out to you after this when it comes to the resources linked on our blog page. And then in terms of prerequisites for getting help, so a lot of us are technical specialists and we're assigned specifically to healthcare customers. And so your Microsoft account team has technical specialists that are definitely willing to help. And we've been doing a ton of that work, especially with the crisis going on, making sure that all of our customers are empowered during these times. So I don't know, Max, if you have anything to add there in terms of empowering everyone with the right resources.
Absolutely. As mentioned before, and as Sam just put it well, you've got a ton of Microsoft technical resources that can help you solution and find ways that this could apply to you that we've never even dreamed of. You guys are on the front lines, and we want to hear from you of how can we help make this even more relevant to you. So keep those things coming. If you're running into issues with maybe a step in the PowerShell or a Power App or a Flow or something like that, you can always feel free to reach out to us, but we'd strongly recommend taking advantage of some of those free partner offers that we're going to send to you to get you up and running faster, just because they can be a little bit more hands-on than we can for you. I'll also mention that this is just a Microsoft solution template. It's not something that's been officially published by our engineering teams and that our support, if you call Microsoft support, that they're going to know much about. So do know that we want you to be comfortable with the solution and feel like you can support it with a little assistance from us as well.
Thanks, Max. And we have another question coming in. So in this version 2, if the patient hovers over the provider's name and their icon in the meeting, can they see the provider's email and phone number there?
Yes, they can. That's a great question. It's one of the things that I should highlight this a little bit further. We really want you guys to read through the known limitations and warnings, and that one is in there. If that is a showstopper for you, the solution that Jim showed a couple weeks ago might be a better use case for you. It's going to require patients to answer the device as opposed to providers just being able to drop in. And that works great for some, not for others. Take a look at that because the providers are joining as anonymous users in that situation. We have some hospital systems that are doing this all from a central nurse station or something like that, which then doesn't have an email address or phone number associated with it either. But again, the device being out of the patient hands helps with avoiding that kind of a situation.
Okay, so we had a lot of questions coming in, but they're slowing down here now. If anyone has any that you want to post, we have like 6 minutes left. Otherwise, Max, if you just want to wrap it up, if there's anything else you want to share, and then we'll turn it over to Mike.
Yeah, I'll just say that we love working with you guys. This is the stuff that gets us excited to go to work. Although none of us wish we were in the situation right now with coronavirus. We want to help you make the best of it and use technologies that you already own to help solve some of these crises that are facing our patients and providers. So do check these things out. Do get in contact with us. And if this is spurring any other ideas for you, whether you think they're far-fetched or easy, reach out to your team's specialists because we are here to help. Thank you.
All right. Well, thank you very much, Max. Thanks, Sam, for all the work on the moderation. So real quickly, I'm just going to go ahead and share out my own desktop here. It says, do you want to share? And I'm going to say yes. And pump that over. So as was mentioned earlier, if you have any questions about what you've seen today, there will be a post later today. Sam will put up the recording on the blog. It's at aka.ms/HLS blog. While you're here, take some time and take a look through a lot of the different content that we have here. We've got all kinds of stuff out here, including things around the health bot, communications. We have the V1 version of the rounding that Max was talking about. That's more of a SharePoint specific, so you don't have all the other licensing that you might need with the V2. But there is a whole wealth of content. We welcome your questions, your interactions, and we are here for you. We want to provide content that's timely for you, that's beneficial, and we want to answer your questions. So I just want to thank everybody for tuning in today. I want to thank our special presenter, Max, moderator, Sam, and with that, this is Mike here in HLS Center, which is actually my home office. Bidding you have a great day. Take care of everybody, and as always, I'm tired. Need more coffee, you can tell from my talking. Take care, and as always, ciao.